You know, the world is changing, and it is changing quickly. One example, overdoses are now the leading cause of death of Americans under the age of 50. Most of these overdoses are tied to heroin or prescription painkillers. The crisis affects the rich. It affects the poor, white, black, old, young. The chances are it's affecting at least one person in your life.
So what can we do? Well, education and awareness are a start, and that's what we try to do here on Delmarva Life. But for those fighting addiction that has the potential of killing them, the road to recovery is not easy, but it's not impossible. Here on Delmarva, a family that has been a part of the medical community for nearly a century is providing help. Chesapeake Treatment Services has expanded and is offering more services to those who need it most. Therapists at Chesapeake Treatment Services are seeing firsthand just how much addiction is taking a hold on people.
It has. We've seen an increase in prescription pill abuse, as well as the age of the abuser is getting younger over time, and it's definitely increasing into a larger epidemic year over year.
Chesapeake Treatment Services has 3 clinics that are dedicated to the recovery of those struggling with opioid addiction. The treatment is done on an outpatient basis.
We provide them with medication to assist with withdrawal and help them to function more normally, and counseling helps them to make the changes necessary to have sustained long-term recovery.
Melissa says the two-prong approach to treating addiction has proven to be very effective for recovery, even for those who might feel there's no hope.
I think they feel desperate at times and feel like there's no way to stop, because opiate addiction really takes a hold of you and makes you feel like that is the only option, that you can't get well. And that's why it's important to use medication along with counseling to help them in their recovery process.
Because Chesapeake Treatment Services is an outpatient clinic, patients are encouraged to build a support system outside of the clinic to help them reach their goal of recovery.
Either going to 12-step meetings or church groups or other support from their family members. A lot of times they'll bring family in, and will help the family member understand addiction and how they can support the person through their recovery process. So support is really important.
But Melissa says all involved have to know that recovery doesn't happen overnight.
It's a long process. You have to imagine someone doesn't become an addict overnight, so they're not going to be clean in a couple of months or have a program of recovery in a couple of months.
Chesapeake Treatment Services was founded and is operated by the Hill family.
Dr. Hill and his family have operated businesses in the healthcare industry for over 85 years.
Melissa says the addiction knows no boundaries when it comes to who it affects. It can plague the lives of just about anyone, regardless of age, race, sex, financial status, or career.
It's a disease. It's a medical disease that we need to recognize as such. And they do need help to arrest that, similar to someone who is diabetic and needs insulin to regulate their blood sugar. You can see some folks who are diabetic who follow a diet perfectly but still need insulin. You have some folks who use opiates who, will need that extra help to keep them well.
Help that will get them back on their feet and back into a productive life. Now, we want to stress that Chesapeake Treatment Services is not just a methadone and Suboxone dispensary. Patients must participate in therapy, which is important for the behavioral change. Chesapeake Treatment Services is a licensed facility which operates within all federal and state guidelines. If you would like to read more about Chesapeake Treatment Services, go to our website, delmarvalife.com.